If you've been following along with our COVID-19 updates, you're going to notice a significant decrease in the percentages of positive cases in Missouri. Here it is on your screen. An average of 7.5% of tests are now coming back positive. The COVID tracking project tells us it's weeded out some duplicate testing due to the new reporting system by the state of Missouri. Meanwhile, the trend remains the same. The reported positivity rate has decreased. Now, as of today, the state of Missouri has reported more than 144,000 cases of COVID-19. And as of yesterday, Kansas has reported more than 65,000. We will get more updated numbers from Kansas on Monday. There's new information coming out about the long-term health effects of COVID-19 on people who were perfectly healthy before catching the virus. Aixa Diaz is in our Washington bureau with a look at the symptoms being reported.
Doctors say some patients are reporting persistent problems with their lungs, heart, memory, and mood. In some cases, people who were perfectly healthy before the virus say they're not back to normal.
We're only beginning to understand what this virus and what the immune reaction to this virus can do in the long term.
Dr. Hannah Axelrod is an infectious disease specialist at George Washington University, where she sees patients who are recovering from COVID-19. She says for some people, the virus has taken a toll on their health months after their initial diagnosis.
Some people report problems with chest pain or heart rhythm or breathing, especially when trying to do activities that used to be simple. One other thing we really worry about is the effects on memory and mental performance, especially in older folks.
Dr. Axelrod says treatment for the virus has come a long way since the beginning of the pandemic, and hospitalization rates have gone down, in part because more young people are testing positive now, and they're less likely to end up in the ICU. But doctors warn that doesn't mean COVID-19 is harmless, and there are too many unknowns to risk infection.
I'm 35 years old. I bike to work every day, and I think I'm more scared of getting this disease now, having learned more about it in recent months than I was early in the pandemic.
And there have been cases of people getting infected twice, but doctors say it's too soon to know how common that will be or how sick and contagious those people will be. In Washington, I'm Aixa Diaz.
And according to Johns Hopkins University, the U.S. has had more than 7.5 million cases of COVID-19. Well, there are several places to get tested for the virus in Kansas City, Missouri next week. The health department's going to continue its drive-through testing events at different locations throughout the week. And you can see those up on your screen right now. Now, walk-up testing starts at 9 in the morning, and those with appointments will start getting tested at 11. And by the way, you don't have to be showing symptoms to get tested. Just a reminder, the Wyandotte County Health Department's changing its normal COVID-19 testing site. Starting Monday, people wanting a test should go to the former Kmart location at 78th and State Avenue in KCK. Hours, though, are going to stay the same. Testing is available Monday through Friday from 9 to 3.